Hello and welcome to the webinar, Being Tobacco Free, How Hospitals Can Meet the Gold Star Standards. We're here today to talk to you from the Breathe Easy Coalition. This is Sarah and Meg is with me. We're going to be chatting for about the next hour on this recorded webinar about the case for tobacco-free hospitals and how to meet the Gold Star Standards of Excellence. As I mentioned, this is a recorded webinar, but you can find all of our past webinars that are being recorded and made available to you for free on our YouTube channel at youtube.com/sfhousing. And you can also contact the coalition if you have any questions from these webinars, and you'll have our contact information at the end. So just briefly, here's what we're going to talk about during today's webinar. A little bit just background about the coalition, going into the case for tobacco-free hospitals. Then we're going to move into sort of our meat of the agenda, which is our 2016 Gold Star Standards of Excellence program and those specific standards. We're going to chat about resources that the coalition has available for you, highlight some important dates to mark on your calendar, and then go through our contact information where we'd have questions. So briefly, I want to highlight about the Breathe Easy Coalition. For those who don't know, we're a statewide organization that works with a mission to decrease exposure to secondhand smoke through the promotion of strong, voluntary smoke and tobacco-free policies that reduce tobacco use and increase tobacco living throughout Maine. We work in 4 primary environments: multi-unit housing, behavioral health facilities, colleges and universities, as well as what we're talking about today, hospitals and healthcare facilities. This work is made possible through support and funding from the Maine CDC's Partnership for a Tobacco-Free Maine. So to jump into it, I want to talk about the case for creating tobacco-free hospitals, and really the case for ongoing efforts to address tobacco and secondhand smoke in general. So to start out, we've got some images here at the bottom showing first 2 reports that came out in 2006 and 2010 discussing the fact that there is no risk-free level of exposure to secondhand smoke. These reports from the Surgeon General also told us that even brief exposure can cause damage that can lead to serious disease and death. On the left-hand side, we've got an image from the 2014 Surgeon General's report showing all of the different cancers and chronic diseases that are related to tobacco use. And so this continues to be an issue, and tobacco use remains the leading cause of preventable disease and death in the United States. It's really important to note that, as many people think we've been working on this for a long time and that the issue is no longer valid, but where we're still seeing such an ongoing problem with nearly 480,000 people dying each year from a tobacco-related illness. And also just to note, in that image, the pieces in red were newly listed as related to tobacco use in that 2014 Surgeon General's report, which is the 50th anniversary of the first report where the Surgeon General said that smoking was harmful. Also, we know that creating tobacco-free areas changes the social norm around tobacco use and promotes tobacco-free lifestyles. And from an environmental aspect, we know that cigarette butts are actually the most littered item in the United States, and those filters are not biodegradable. So if you want to reduce cleanup costs and be part of a sort of green stance, it can be helpful to create a tobacco-free policy. So to just talk a little bit more about the dangers of secondhand smoke, you'll see on the right-hand side of the screen, this is an image of our new secondhand smoke rat card that's available, and with the link on the bottom of the slide. But we know that really secondhand smoke, there is no safe level of exposure, and there's more than 7,000 chemicals, at least 69 of which are known to cause cancer in humans, and that exposure can increase the risk of developing heart disease for a non-smoker by 25 to 30%, and for developing lung cancer by 20 to 30%. And there have been a number of studies focusing on secondhand smoke exposure in outdoor settings, This is a study out of California. We want to highlight the fact that research has found that smoking within 20 feet of a non-smoker causes harmful levels of exposure that can be as high outside as they are inside. That's why having that area where you're really sort of pushing the tobacco use a little bit further back from entryways or making your campus tobacco free is so important, because that secondhand smoke and those toxins are still present. Next up, we want to talk about a more sort of still emerging issue of awareness, which is third-hand smoke, which is the tobacco residue that lingers after a tobacco product has been extinguished or put out. And unfortunately, after that smoke clears, the toxins still linger, which may leave that stale tobacco smoke odor that we've probably often all been aware of. Unfortunately, we know that that third-hand smoke that settles on surfaces, on clothing or hair, can actually include chemicals that can be reintroduced into the air and inhaled long after smoking has ceased. We also know that this third-hand smoke contains chemicals that are known to cause cancer and can be especially harmful to infants and children as they're more exposed to it, because maybe in home settings and areas where they could be crawling on the floor and putting things in their mouth that have third-hand smoke, that it would be a way to take that on. But there are efforts that you as a healthcare provider and organization can do by making protections about third-hand smoke by putting that language in your tobacco or fragrance policy. And when we talk about this, we've talked a lot about cigarette smoking and a lot of that second-hand, third-hand smoke that are really related to traditional combustible tobacco products. But there's a lot more to this broad definition of tobacco products that we talk about that's important, and important to make sure you're addressing. We know from the Surgeon General that nicotine is addictive in any form, and the Surgeon General has also stated there are no safe tobacco products. So when we look at some of these other products like your chewing tobacco, snus or snuff, they still contain tobacco and nicotine and are very addictive. Again, we also have our newer products that are coming out, the electronic nicotine delivery systems, which include e-cigarettes, e-hookah, and other electronic smoking devices. And they can contain nicotine, which is addictive, but also we are still learning about them. We just found out that the FDA is going to start looking into and regulating these products, but we know that they might emit nicotine, propylene glycol, carcinogens, and other harmful substances. But what's also concerning is the large number of young people who are starting to use these products. So we get back to that social norm against tobacco use, and we want to make sure we're incorporating all of these products, which is great. What we saw from a CDC report in 2014 was that the increased use could be due to the increase in marketing, availability, and the visibility of these other tobacco products, and a perception that they might be safer alternatives to cigarettes. Well, and since we know that there are no safe tobacco products and nicotine in any form is addictive, it's important to make sure you're addressing all of these different products in your policy. And so we've talked a lot about the different components as to why we should address tobacco from the health case, but how do we do that? Oftentimes it can feel very overwhelming, and knowing also that sometimes policies are a hard thing to implement. They take time, and once you implement the policy, put that date that you put it into effect, the work just begins, and we understand how challenging those can be. But it's really important to remember that they are an evidence-based approach to address tobacco. Creating tobacco-free policies can have a nice comprehensive impact. So, and this is from the federal CDC's community guide that does all of the research to figure out what approaches are evidence-based, and they found that creating tobacco-free policies will reduce exposure to secondhand smoke, reduce the prevalence of tobacco use, increase the number of tobacco users who quit, reduce the initiation of tobacco use among young people, and reduce tobacco-related morbidity and mortality, including acute cardiovascular events. So these are all great reasons that you can implement a strong tobacco policy. And I'm going to turn it over to Meg to talk about some tips for that.
Thank you, Sarah. So we're going to cover some policy tips here, and we'll get into some more about our Gold Star standards. So there is support for tobacco-free hospital campuses throughout the country and in Maine. So nationally, more than 3,800 hospitals have adopted tobacco-free policies, including over 90% of hospitals here in the state of Maine, which we think is absolutely fantastic. The cost of smoking in Maine, I mean, there's some staggering numbers here on the screen. $800 million annually in healthcare costs and $647 million in productivity losses. And tobacco use and related illnesses can lead to prolonged hospital stays, increased chances of complications, and higher rates of readmissions and longer recovery times for patients. So supporting tobacco-free hospital campuses, as Sarah had just alluded to, help people who are tobacco users want to quit and things like that. So there is growing support for these. So moving into our Gold Star Standards of Excellence. So for those of you who this may be new to, this is an annual program that we do here at the Breathe Easy Coalition. It's voluntary and it's free. It's a recognition program for hospitals aimed at creating tobacco-free environments and supporting tobacco-free lifestyles. It is 10 evidence-based tobacco control standards that hospitals can meet through written policies and procedures. So this is an opportunity for your organization to be highlighted as a leader in the state for addressing tobacco on your hospital campus and within your community. So how does it work? Applications are developed by a subcommittee of our coalition members and have been distributed throughout Maine. Paper applications were mailed to contacts at every hospital throughout the state, and then we have multiple emails with the online application. So we encourage all hospitals in the state to apply, and then organizations that meet at least 7 of our 10 evidence-based standards will be recognized. So the link, some important things on this screen include the application deadline, which is August 26th. And then mark your calendars for our celebration event, which will be on Thursday, September 15th at the Maine Hospital Association in Augusta. And if you have not already submitted your application, the easiest way we think to do that is through our online application, which the link right here at the bottom of your screen, mainetobaccofreehospitals.org/gold-star application, with hyphens in between gold star and application. If you would prefer to do it as a Word, type it in a Word document and then print it and mail it or email it to us, you have the ability on this website to download a Word document version as well. And who has participated in the program? We have been doing the Gold Star Standards of Excellence program since 2010, and we've seen significant growth each year. So this is a fun little graph here that shows the total numbers of hospitals that have participated in the program, and then of those, how many met gold, silver, and bronze. So you know, last year we had 33 hospitals, 26 were recognized gold, 2 at silver, and 5 at bronze. So we're hoping every year to make that gold number grow and our total number of hospitals grow. And how can you get there? So we're going to move into the standards for this year and how you can best meet them. And I'll turn it back over to Sarah.
Great. Thanks, Meg. So we're excited each year to sort of strengthen these 10 Gold Star standards. But know that Maine hospitals are up for the challenge. So Meg and I are going to go through the 10 standards with some tips of how you can meet them, but also what the requirement is, because oftentimes if you're new to looking at the application, that can be a little bit overwhelming or confusing. So I'm going to start out with Standard 1, and you'll see here just to understand the formatting, it can look like a lot of text, but on the left-hand side we're having the language straight from the application. So that's why we've got a lot of text, but hoping that it can be helpful for you. So the goal here for Standard 1 is that the hospital has a 100% tobacco-free campus policy. And it's important to have a written policy that covers all tobacco products. We highlighted that importance early on, and for here we provided an example definition of including cigarettes, electronic smoking devices, smokeless tobacco, snuff, chew, snus, cigars, pipes, and non-FDA approved nicotine delivery systems. You also want to make sure that this policy covers your entire hospital campus, including parking lots, where oftentimes people are going out to smoke or to, but people could still be exposed to secondhand smoke. So making sure that those are included as a component of your campus policy, which is important to be able to meet this standard. And we ask that you, to meet this when you're filling out your application, provide a copy of your current policy and describe it with the application. So we pulled some sample answers for a guidance document that got sent out with the application and is also on our website. And so we pulled some of those in here for examples to give you a highlight how you can meet this. So a sample good answer for this came from Lincoln County Healthcare, and they included their 100% tobacco-free campus policy along with providing this description, explaining the fact that their tobacco-free campus policy covers all forms of tobacco product and use, and that tobacco products are not permitted on or within any of their facilities or subsidiarily owned, leased, or operated properties, grounds, or parking lots, including in personal vehicles. And that the policy applies to everyone who is a member of their Lincoln Health community. So this is a great example of a best practice answer and approach to addressing tobacco policies.
All right, so standard number 2 is around exposure to third-hand smoke. So the policy, the hospital has a policy and clearly defined procedures to reduce patient and employee exposure to third-hand smoke. So this and materials are available for patients and visitors regarding education around third-hand smoke. So this, with a lot of hospitals, this is in their dress or appearance policy or a fragrance policy. The third-hand smoke is listed under all of the things. A lot of healthcare organizations don't allow employees to wear perfumes, and they just list third-hand smoke or the smell of lingering tobacco smoke in that same policy. So again, with this standard, you would provide a copy of the hospital's current policy or procedures pertaining to third-hand smoke with your application. And as we will go through all of these standards, we have some best practice sample answers. From this one happens to come from Spring Harbor Hospital. So Spring Harbor's, theirs actually falls within their tobacco-free workplace policy that clearly states that it is a fragrance-free policy, which also, fragrance-free hospital, which also includes third-hand smoke. And then it goes on to say that Spring Harbor Hospital recognizes third-hand smoke as a harmful residual particulate and odor from tobacco smoke, and indicate some information here as to who is responsible for it, including managers for their employees, and information around the hiring process. And they do a bunch of hospital-wide education during the Great American Smokeout.
Great. For standard 3, really looks at the hospital's policy and making sure that there's a plan for education and enforcement. We know that awareness, signage, and enforcement are the keys to policy compliance, and that can be one of the challenges that a lot of hospitals see. So it's making sure that there's a written plan for policies and procedures as to how the policy will be enforced and what the employee expectations are. Because again, we can't expect people to do things unless we tell them what that is. So that you're asking people to know about the policy, they're acknowledging it in writing, they're aware of it on an annual basis. But it's also important to note with this standard, we get a lot of questions regarding hospitals that are not 100% tobacco free and if they can meet this standard, and the answer is yes. This is not about, we know that all of these build off each other, but knowing that they also, you don't have to wait until you have a 100% tobacco free campus policy to be able to be having good enforcement and compliance. That can actually help you to be ready to go 100% tobacco free if things are going really well with your current policy. So please, if you're not able to meet standard 1, still apply for this. We ask people to list at least 5 strategies that they meet. On the next slide, we're going to go through, there's some strategies that are listed right in the application that you can consider And there's also an area to write your own in, but we're asking people to be doing at least 5 different things that are around awareness and enforcement. So here are some example strategies. As I mentioned, these are in the application as possibilities to check off that are based upon what we've learned are working at Maine hospitals. And so we wanted to sort of build from that. So it's ideas that include having the tobacco policy mentioned in education at new staff orientations, having progressive discipline plans for employee violations that are written into the policy and made clear for employees to understand. Information about the tobacco-free policy is readily available on the hospital's website and or through the HR department. The employee training on how to handle policy violations with employees, patients, or visitors is provided for staff. We oftentimes hear from hospitals that have issues that people don't feel empowered to go up and talk to someone who's smoking, or how to have that conversation, and who's responsible for having those conversations. So providing training and understanding to staff can be a great thing. That you're providing patients with information on the hospital's policy on admission and again during the hospitalization as necessary. So making sure they're aware for that patient who might be dealing with tobacco use cravings, but also is going to have visitors who might be tobacco users that are going to need to be able to comply. An idea of leadership walkabouts of the grounds to understand what's happening with tobacco use and to help support compliance, but also shows the fact that there is support from the top for this policy, which will help with enforcement. Staff involvement in cleanups of tobacco-related waste on the campus, looking at that, talking about it. Again, it keeps the tobacco policy as part of the communication. And that one that we hope that a lot of people are doing, because we know it's one of the first steps for education, is that you have policy signage throughout your campus explaining what your policy is, that's around the campus, on entrances, on buildings, making sure that in the areas where people might be not complying with your policy, say there's a bench and people are going there and smoking, put a sign there having those pieces. So providing examples of these pieces or any other great innovative approaches that your hospital is taking are ways to meet Standard 3.
So moving on to Standard 4, this standard is around tobacco advertisement or promotion. So prohibiting advertisement or promotion of products on your campus and satellite facilities. This includes in hospital publications and magazines subscribed by the hospital. We actually had a question earlier this spring around tobacco advertisements in magazines and whether it was already prohibited at the state or federal level, and unfortunately the answer to that is it's not. There are restrictions around tobacco company advertising and marketing in magazines, but it is not outright banned like it is on television. So many magazines still include tobacco advertising. We have Maine Tobacco-Free Hospital Network stickers that we can give you if you are interested in them, that can be stuck on magazines, on those ads or on the covers, saying, you know, we're a tobacco-free campus and we don't support tobacco advertising, to help change the social norm around tobacco, and also describes your efforts as an organization to address tobacco advertising. So some other examples of how you can meet this is to only allow magazines that without tobacco advertising, because there are some. Again, using the stickers that we have, if you have donated magazines or subscribe to magazines that may contain advertising, you can remove the ads from these magazines before having them in waiting rooms. We hear from some hospitals that they have a volunteer base that go through the magazines before they're putting them out in their waiting areas and either add the stickers or remove the ads. We have other hospitals that post flyers or table tents in the waiting areas where magazines might be that just says there may be tobacco advertising in these magazines, but the hospital doesn't support that type of advertising. So that's some examples of how you can best meet Standard 4.
For Standard 5 is really about making sure that there is education about tobacco dependence and treatment, second and third hand smoke, and local and statewide tobacco treatment resources made readily available to patients and visitors. So this is, for example, brochures about the Maine Tobacco Helpline are displayed in patient or visitor areas. There's proactive fax referrals to the helpline. There's discharge paperwork that reminds people about the dangers of secondhand smoke or not smoking in their home. A variety of different things of really making sure that you're keeping tobacco related materials out in your waiting areas, proactively giving them to patients, including them in admission or discharge packets, a lot of different opportunities. One of the really great things here in Maine is that there are a lot of free materials that are available. So this isn't something that should incur a cost for your organization. For the second and third hand smoke, there are a lot of great fact sheets, rat cards, infographics from the Breathe Easy Coalition. If you're interested in information about quitting and having materials about the Maine Tobacco Helpline, the Maine CDC and Maine Health Center for Tobacco Independence have great resources that can help support your educational efforts that can be put in there. So there are a lot of different things you can be doing. And to meet the standard, we ask you to describe what the hospital's efforts to educate patients and visitors about tobacco use, exposure, and treatment resources are. And so here is an example answer from Franklin Community Health Network up in the Wilton-Farmington area. And they explain sort of the comprehensive approach they are doing to meet Standard 5, which includes that there's information on the benefits of quitting, tobacco dependence treatments, second-hand smoke, third-hand smoke, and local and statewide treatment resources communicated to patients and visitors by providing various literature from all of the different folks I mentioned before. And there's other educational materials such as a passive smoking letter that's given out through Franklin Community Health Network office practices and in inpatient units. Literature is available in waiting rooms, patient packets on bulletin boards and with discharge instructions. And patients are informed about these resources during tobacco counseling, which will be sort of builds on some of the things that Meg's going to talk about in just a minute. And if patients are not open to conversations about tobacco treatment, they're at least given this information. So there's a way to self-educate and utilize some of these things. And they also said that they utilize the website to distribute some of this information as well. So this is a great example of how you can incorporate some of these messages and health messages into your day-to-day efforts.
So moving on to Standard 6, this is around the hospital as an organization supporting evidence-based tobacco treatment training for staff. This one is the same standard as it was last year, but we have reworded it a little bit over the last, 2 years to make it more clear in what we are hoping organizations are doing. So this is the hospital supporting staff to attend education opportunities for tobacco treatment, evidence-based tobacco treatment training by offering in-service trainings or financially supporting them to attend trainings off-site. And that there's literature and resources available on-site for staff, and that trained staff are available to provide tobacco treatment counseling to tobacco-dependent patients. There are a lot of trainings available for providers on tobacco treatment, and utilizing the Center for Tobacco Independence at Maine Health is a great way to get some more information about this. So what we ask in your answers is that you describe the staff education related to tobacco use and dependence, the training. So here is a sample answer, a very lengthy sample answer from Maine Medical Center and how they address tobacco treatment. So they note that they have tobacco treatment programs staffed by 4 nurse practitioners who provide services 7 days a week. They are trained and certified as tobacco treatment specialists to provide evidence-based intensive counseling and treatment based on an individual's needs. Their staff is supported to attend local and regional conferences, and they go on to state that they've had a large number of staff in all departments attend tobacco-free initiatives and be supportive of these types of educational programs within the region and within their organization. So they have very large numbers, but they are a much larger hospital than all hospitals are. So we know that this answer may not be practical if you're at a smaller organization, but it doesn't mean that you aren't able to do something, and we're hoping that you have the ability to promote something around tobacco treatment education for your staff.
Great. Next up for Standard 7, again the same number as it was last year, but we've tried to tweak it to make sure that 6 and 7 are well understood. This is really about administering tobacco treatment. So as Meg just mentioned, we want to make sure that staff are utilizing the evidence-based resources that are available to get those trainings, and that you're, as an organization, you're supporting those staff. But we want to make sure also that it's getting implemented at the organization. So we're asking you to describe how patients are made aware of tobacco treatment resources, so any screening that's happening, and what tobacco treatment services are delivered, and what staff are designated for implementation. So looking at this, it's really focusing on the public health service guidelines for treating tobacco use and dependence, and making sure that you're going through including your tobacco dependence counseling and education at the bedside, or any assessments that are done, management for patients who are experiencing nicotine withdrawal, including what we're hearing from a lot of organizations that they provide FDA-approved tobacco treatment medications while people are in the hospital, and you're referring people to counseling post-discharge, because oftentimes that hospitalization is what is helping someone make that decision to be tobacco-free. Or oftentimes you hear the story of someone saying, well, I didn't realize that I could get through that week in the hospital without smoking, but now that I have, maybe this is my time to do that. So making sure that it doesn't just stop when they're discharged, that there are great resources like the Maine Tobacco Helpline that are free and available, or there might be a local clinician who's able to help, but making sure that there's those tobacco treatment opportunities along the continuum of care is important. So we ask hospitals to highlight what they're doing around this area. So just explaining the process of what's available, if it's in your electronic health records, how you're putting that in there, where are there, sort of reminders for clinicians to do this, and who might be designated to implement tobacco treatment. Is it a department? Is it the nurse? Is it the physician? Who's responsible for that? And so as we mentioned, we encourage people to follow the public health service guidelines for treating tobacco use and dependence. And you can find this online, but really that's why those trainings that Meg just mentioned in Standard 6 from the Maine Health Center for Tobacco Dependence are great. And because you really just want to make sure that that's really pulling you in to follow the 5 A's of ask, advise, assess, assist, and arrange for follow-up. So there's a lot of great resources that are out there, but just making sure that you're writing in what your organization is doing.
All right, so Standard 8 is tobacco treatment services, and that we want that, in this standard, tobacco treatment services are a covered benefit in the organization's health insurance package for employees and their dependents. So benefits would include coverage for counseling, medication for quitting tobacco with minimal or no barriers to utilization. So this is out-of-pocket costs or limits on these resources. So reducing the barriers to having somebody get the help they want or need to quit tobacco can help them be successful. So we're asking you to describe what benefits are available for hospital organization employees and dependents for tobacco treatment and dependence. So a sample answer here from Stevens Memorial Hospital. They have a whole number of things that they're doing. So they state that for all employees, spouses, and dependents, they can meet with their tobacco treatment specialist for free and help with make a personalized quit plan, options to help employees who may be tobacco dependent to get through their day if they're not ready to quit, free tobacco cessation classes or groups. If they're on Maine Health Insurance, tobacco treatment providers are free, medications are free for employees and dependents, and the ability to meet with a tobacco treatment specialist to discuss medications are all available through their WOW, which is their Worksite Wellness Tobacco Treatment Program. So some great things that are being done. And if you can just describe what is going on at your organization around tobacco treatment services for employees, that's what we're looking for Standard number 8.
Awesome. For Standard number 9, we're sort of jumping out into the community. We mentioned again that there's no risk-free level of exposure to secondhand smoke. So we want to make sure that when people are coming to visit your hospital and those patients or visitors who are staying in local lodging, that you're helping to encourage smoke-free lodging options. So making sure if the hospital provides a list of local lodging, that you're designating what properties are smoke-free, so you're letting people know so they can have the opportunity to make healthy choices regarding their lodging. We're hoping that there's a list that's made easily accessible and that's reviewed and updated annually. And so this is the time to be able to look in at it and say, okay, what are we offering? As we know, most hospitals do have a list, or they have a office that's someone at the front desk who might be designated to do this if it's not a physical list, but they have a resource that helps them be able to know what are the smoke-free options. So make sure to provide a list of the smoke-free lodging options of what you provide to patients and visitors with the application, and describe how you do this and how it's made accessible. So an example of a great answer from Mayo Regional Hospital was the hospital owns a home near the hospital for visiting staff, guests, and providers. That building's tobacco-free, and our local service area has no major hotels, because we're talking about a smaller community. And it says they have local bed and breakfasts that are designated smoke-free. And when they submitted this with their application, they submitted a list of those that were smoke-free, so that they were able to distribute that out.
And the final standard, standard number 10, is around donations. So this is the hospital having a written policy or procedures stating it refuses all donations from the tobacco industry and divests itself of all tobacco company stock. So we're asking that you provide policy language or procedures and or guidelines that explain the hospital's position on tobacco industry donations. So sample answer number 10 from Central Maine Medical Center. They wrote here, to align our philanthropic strategy with the hospital's mission to improve community health, every effort will be made to refrain from investing in companies that produce tobacco products. Our investment director of development screens holiday donations regularly to ensure that the Central Maine Healthcare does not hold stock or take donations from companies that produce tobacco products. So short answer with this one, but has an impact as well.
Awesome. So those are our 10 Gold Star standards. And we know that it can be a little overwhelming to think of how to take on all of these. And we hope that people are already doing a lot of this. And that's what these are built on, things that we know our healthcare providers and healthcare organizations are doing. But we wanted to make sure to highlight some of the resources that are available to help you, because you're not in this alone. And the Breathe Easy Coalition is here to support your efforts. So just a couple of examples of how we can help you implement these tobacco-free policies and support that ongoing implementation, because we know that that's happening. Part of which is the Gold Star Standards of Excellence. The annual program is an opportunity to be recognized and highlight this. And we hope that you can take that back into your community and use that as a way to educate people about tobacco and why it's important to address it as a role model for health. But we also can help with the more tangible stuff. We have a variety of resources that we hope would be useful. Fact sheets, rack cards, infographics on tobacco-free hospitals, as well as the dangers of second and third-hand smoke, electronic cigarettes, and other areas on Maine laws. So we can have those that you can utilize out in for those areas, maybe in meeting the standard about community education, or it could be just to educate your staff or your providers. We also have a lot of template policies and also samples for how to, both the timelines to how to adopt a policy, but also enforcement strategies and techniques. So we've got a lot of resources that you can utilize there. We have a great comprehensive website you can see at mainetobaccofreehospitals.org, and you'll see the screenshot of the homepage up there. And that's where you'll find more information about the Gold Star Standards, as well as facts, resources, background pieces, and hope that can be a great place to start when you have a question, to be able to check those out. But also that's a great way to get the contact information to be in touch with us at the coalition. Because one thing we can do is we can also provide one-on-one technical assistance. So if you're having an issue and you want to find out what another organization is doing to enforce a policy or how to incorporate a new emerging product into your policy, we can help you with that language and with examples of what's happening across the state or even across the country. We try to keep a pulse on all of those pieces and can help you take that on. We can help sort of coach you through some of those pieces, provide presentations and different areas. So just to keep that in mind, that while this might be overwhelming, there are a lot of resources as well as people to help you implement this. So Meg highlighted them earlier, but we want to come back to some important dates with the Gold Star standards. Really those applications, we've already started receiving them here at the beginning of the month of August. So thanks for our early birds. But we are accepting those through August 26th, and you can find that electronic application right on our website at mainetobaccofreehospitals.org/gold star application with the hyphens in there. But that really gives you an opportunity to check that out. You can download a Word document version, but please get those in by August 26th. Also, we're looking forward to having a great event on September 15th, which will be our celebration. Each year we have a great time at the Maine Hospital Association up in Augusta, highlighting the hospitals, being able to have the photo ops and recognition opportunities. But this year we're going to make it a little bit bigger, and also in response to a survey that we called for to get what people would like to see out of that celebration event, we've decided to broaden it and have it both be a celebration and educational event. So it's going to be from 11 to 2 on September 15th at the Maine Hospital Association. We're asking people to RSVP so that we can get a proper head count, because we're going to be having a lunch. But we'll do the awards first thing at 11 and recognize all of those pieces, but then have a lunch and then an educational session highlighting some of the important emerging issues that we've been talking about, and also talking about some of those questions that people have regarding enforcement. So we hope that you can plan to attend that or bring a couple folks from your organization. And you can see the link to RSVP, but that will also be sent out both with the webinar recording as well as a reminder that will go out when you complete and turn in that application by August 26th. So we really want to thank people for participating on the webinar today, and have a quick reminder about the ways you can get in touch with the coalition, and we hope that you'll stay connected. So here we have our, as we mentioned, our mainetobaccofreehospitals.org website. And if you go to mainetobaccofreehospitals.org/GSSE, it'll take you directly to all of the Gold Star Standards of Excellence resources. You can also learn more about the coalition and some of our general resources by visiting breatheasymaine.org. Additionally, you can contact us by phone or email, and we're on all the different social media platforms, which is also a place that we end up putting a lot of the photos and information about the hospital awards or to recognize your organization. So please make sure your organization or you individually is connected with BEC on Facebook, Twitter. YouTube is where you can get all of our past webinars and trainings, and on Instagram. Thank you very much for listening to today's webinar. We hope that you'll find this useful information, and thank you for your efforts to create tobacco-free hospitals.